Hello, my name is Robert Bache. I own Senior Healthcare Direct, MedicareBob's office, and we help people with their Medicare nationwide. It is my privilege to introduce everybody to Ryan McMullen. He is the Vice President of Senior Sales for Banker Fidelity. How you doing, Ryan?
Doing good. Thank you for having me.
Good. Thank you for joining us. I love when a carrier comes and visits our agency and talks about the products and the future of Medicare and the other products that you guys have to offer people. And would you please share with me and everybody else that's watching a little bit more about Banker's Fidelity in case that's a Medicare supplement or carrier name that people haven't heard of?
Sure. Yeah, we've been in business since 1955. We primarily started as a large life insurance carrier, but then over 35, 45 years ago, we started getting into the Medicare supplement market, and then we've also done short-term recovery care. We do cancer products and just an assortment of senior products that are helpful for everybody.
Cool. And where are you guys based out of as far as customer service and claims filing?
Our headquarters is based out of Atlanta, Georgia.
All right, very cool. And what are the three most popular product lines that you're seeing right now that you guys are offering?
Right now, our most popular product lines are going to be our Medicare supplement and Banker's Fidelity Life Insurance Company. And then we also have our short-term recovery care, and then we also, it's called Vantage Care. And then we also have our cancer products that we just launched.
Okay, so I'm going to spend a few minutes. I would like for you to help explain the latter two. I'll go ahead and kind of, for those of you that follow my YouTube channel and follow me on Facebook, I'll kind of give a brief summary of Medicare supplement plans. Medicare supplement plans are standardized. The Medicare Supplement Plan F is the most comprehensive plan. If you were on Medicare before January 1st, 2020, you're eligible for the Plan F. I call that the full coverage plan. With that plan, Medicare is your primary, so you can go to any doctor, any hospital, and you won't have any of the bills that Medicare would normally charge you for. Medicare Supplement Plan G, I call greatest value. It's going to fill in all the gaps in Medicare except for that Part B deductible, which this year is $198. And Plan N is a very popular plan that we're seeing more and more people choose. It's got a little more cost sharing. It's more affordable on premium, but it's a true Medicare supplement, so you can keep your doctor, you pay that deductible, and you have a couple co-pays. Now, the second product that you mentioned was Recovery or Vantage Care?
Vantage Care, short-term care, yes, sir.
Okay. What product is that, and who would need that product? How does that help people?
No, so this product is a very unique product in the marketplace. It's a very good other option for folks that might be concerned about recovery and skilled nursing facility or at-home care. So a lot of people can't afford long-term care, or it's very expensive. It's also very hard to get qualified for it. This is another option for them to still get some of that extended care they may need through a skilled nursing facility or at home at a low cost. So.
It's interesting you say that because unfortunately a lot of people, when they start thinking about long-term care, it is too late. And what I mean by it's too late is two factors. One, the cost. You know, the right time to buy long-term care is when you're 35 or 40 years old. That's almost when
Correct.
It's affordable. But, you know, people like us, you know, my age, that's about around my age, and buying house and got the kids and club soccer and all this other stuff. So it's hard for me to budget long-term care now. And so I talk to people that are in the same situation, and then as they get older, they want to purchase it. And one of the barriers is the cost for long-term care at the age that they're finally ready to do it. And then the other barrier is they have to medically qualify for long-term care.
Correct.
And so there's like, you know, 2 or 3 pages of health questions that people have to answer to get long-term care. So a lot of times I'll talk to somebody who's on Medicare already and they want to talk about long-term care, and those two barriers are the cost and the fact that they can't medically qualify for it at this point.
Correct.
And so your product, which I'm a big fan of, and we also offer it, so if you'd like to learn more about it, just contact our office. It's a really good solution for somebody who at this point, maybe they missed the boat on long-term care and they want a more affordable option now that they're on Medicare. And then the third product that you talked about that you're seeing a lot of movement on is cancer, which I'm a big fan of.
Correct.
Can you explain how that works?
Yeah, so it's a lump sum cancer product. You get diagnosed with cancer and we pay you a lump sum amount of money. So very, very easy underwriting, 3 medical questions, and it's just very, very popular because there's a lot of unexpected costs with cancer. So.
Okay. And a lot of the people that are watching today, they're on Medicare. That's why they're watching MedicareBob's videos. And so if you don't mind, I'm going to share how that would work. So a lump sum cancer policy is a great product whether you have a Medicare supplement plan or a Medicare Advantage plan, and here's why. If you have a Medicare supplement plan, we are seeing more and more costs, about what did you say earlier, 54% that we were just talking about are non-medical costs?
Correct.
So if you have a supplement plan, yes, Medicare is going to pay 80% of your treatments, and then your supplement's going to pay the other 20%. But that's only part of the cost of going through cancer. And we're also seeing a lot more prescription drugs now to treat chemo. So a lot of the prescriptions that you would get, or a lot of treatment that you would get in a doctor's facility where it's covered by Medicare and then your supplement, now we're seeing more and more Part D drugs that people can take at home to treat the cancer. So on one hand, it's convenient that they can take it at home, but
Correct.
the bad part is Medicare Part D can be more expensive than, to get those prescriptions. And then if you have a Medicare Advantage, it's a no-brainer to have a cancer policy. So our office offers both Medicare Advantage and Medicare supplements, and we only will offer somebody Medicare Advantage if they agree to get a cancer policy. And this is because it's the biggest hole in all Medicare Advantage plans. In fact, most Medicare Advantage plans, as you know, they do not cover cancer necessarily any better than the 80% that Medicare covers it by itself. Now, what's nice about most Advantage plans, they do have a max out of pocket, which is usually around $6,700. But if you get cancer, let's say in September, your treatments are also going to carry over into the following year. So people are going to meet that $6,700 max out of pocket sometimes within 6 months. That's $15,000 that a senior has to come out with while they're undergoing cancer treatment that they don't have. So what's nice about a lump sum cancer policy is if God forbid you get diagnosed with cancer, which a lot of people do. What are the numbers?
1 in 2 men and 1 in 3 women.
1 in 2 men. So
Correct.
you have 1 in 2 men are going to get diagnosed with cancer and 1 in 3 women?
Correct.
Okay, so it's very likely, there's some likelihood there that you're going to get some type of cancer in your life. And what's nice about the lump sum cancer payment is if you have an Advantage plan, you're going to have all these costs that go with that. You're going to get that check of $15,000, $20,000, or $30,000 depending whatever you choose. So I'm a big fan of cancer policy, whether you have a Medicare supplement or a Medicare Advantage plan. And of course, our office offers those. So if you'd like to learn more about that, we'll drop a link to get a quote on that on the description, and as well as our phone number is listed on the video. Well, Ryan, I want to say thanks so much, man, for joining me.
Thank you for
I
the
love
time.
you. I love Banker's Fidelity. And you guys have a great product line, great rate stability on your Medicare supplement plans. I know you guys are going to continue to grow that business. So thank you so much for joining me, and thank everybody else for watching.
Appreciate it.